Hello guys, so you've got 2 videos in one day. I'll address you on a few things that's been going on. Primarily my treatment. So if everyone remembers, I was on something called Tobramycin inhaled through the nebulizer. It was a mouthpiece and I nebulized it twice a day. There was a shortage last year at Christmas time. It was supposed to be a national shortage of Tobramycin in like nationwide, so not just Manchester, not just London, everywhere. And this meant even for the people with cystic fibrosis, not just bronchiectasis. So what I had to do is, with the medication I had left, because I used to cycle around my IVs, I'd have about a couple of weeks left, and then that would mount up as well on top, and mount up on top, so I'd have a bit. But what was left to do was like take a daily dose, maybe one, have a day off, one, things like that. So I was trying to still use it like a rescue pack. I got promised after promised, lied to, that it was coming back. I was getting it this month, that month. So the point is, I've lost hope in getting it. So I've reached out to my specialist because enough's enough. I feel like it's mental torture now, not knowing if you're getting the medication or not. I'd rather them just tell me straight, you're not getting it, and we can move forward on a new prophylactic antibiotic. Now, I'm going to have to recap because I don't believe anyone's going to remember this. But I tried everything from amoxicillin, azithromycin, and things like that to no avail effect. So what we did, we tried the gentamicin or the colomycin in the blue machine. And at the time I was living in a skanky damp house, and because it was skanky and damp, it made me really poorly. So I wasn't sure if I was having side effects from the gentamicin or it was the house with the damp. So I think we're looking at that avenue now, whether to trial it again and go from there. So it's been a case of just using rescue packs of doxycycline, steroids, and then cycling the meropenem as well. Now what's coming, which we're not having it, I'm telling you, kicking, screaming, banging bronchiectasis, it ain't happening on my watch anyway, is they think, the nurses think they can bring something into play that can stop your treatment, which they're not specialists, so they can't stop your treatment. The purpose of the IV cycles is to keep bugs dormant the best they can. Now, they've come up with a logic which will not work. It just won't work. A specialist won't take it on. And what they're trying to do is get you to do a sample before your IV cycle starts. Now, we don't mind doing that. I don't mind doing it at all because it gives them a sense of what I'm growing. It doesn't give the big picture as well, if I need them or not, because sometimes you can't get the bacteria up. If you know a bit, the bacteria could be on the left side of the lung, you're coughing and you bring it up from the right side of the lung. It could also be deep down, penetrated in the lungs, that only a bronchoscopy can see. So it's almost like they're trying to mess about with bronchiectasis patients' treatment. It seems like they're stripping everyone of the entitlement away. And I'm telling you, ain't happening on my watch. That's why I'm back.